Much of our work revolves around convening. We bring the leaders together. They share their lessons learned, their travails, the challenges they've confronted, the hurdles they've overcome, the ones they've stumbled on and made them fall down. They teach each other, and we help that conversation go as smoothly and as accurately and as openly as possible.
There was a real thirst and need among state people for a way to be able to convene across agency lines. There really was this cadre of people in various places in state governments and in state universities across the country who were just immensely dedicated, immensely knowledgeable and talented folks who really had a lot to offer, and if given a forum and a community of interest to get together, could do good.
We really matured as an organization and became a knowledge base where others could learn about the states and where we really could engage in a meaningful dialogue.
I think it now, probably with a Washington presence, has more capacity to work with the federal government and link the states and the federal government and to do that kind of analytical work.
I think NASHP makes an effort to try and translate in both directions, both from the states as well as to the states, what the expectations are, provide greater clarity as to what intentions are with respect to legislation and regulation as they become available.
I'm always looking for great ideas about what works in states. And one of the unique things about NASHP is that the collection of state administrators, from Medicaid to public health to insurance commissioners, and there's always a wealth of information about what states are doing on the cutting edge in terms of programs.
I think NASHP, in all of its approaches in terms of generating knowledge, connecting knowledge, bringing peers together to identify shared problems and problem solve, and to do so in a very respectful and safe place. I just think it's made a real difference in terms of states' ability to execute tough jobs in very, very difficult environments.
NASHP came along at a really critical time in health policy. You know, it was a time when people were first starting to really try to grapple with these issues in a meaningful way on a state level. In New Jersey, some of the things we learned from NASHP helped us craft some really meaningful health reform that led to thousands of people in the state having access to primary care for the first time.
We worked very closely with CMS on Medicaid managed care, convened groups to set forth in a collaborative way with the federal government quality standards for Medicaid managed care. When CHIP began, the Children's Insurance Program, we convened the state leaders immediately, created CHIP Chat, a mechanism to help the leaders talk among themselves.
NASHP has always served as the unofficial association for CHIP directors. Without that, there really is no other forum for CHIP directors to communicate.
Their information is credible, it's high quality, it's great analysis. I've also found that they have practical information in toolboxes and toolkits, and they provide great technical assistance.
As the world of health policy, as the world of healthcare evolves, this organization has evolved, and that's really critical because some organizations get stuck. They stay just where they are, and organizations who do that tend to go away.
It needed to be organic. It needed to be up by and for these people. And so long as it was structured in a way that it continued to pursue excellence and not be reduced to at least common denominator politics and so forth, that it seemed to be something that could survive over time and could improve over time.
This one not only has stayed, it's grown, it's able to meet the needs of state health policymakers still today as it did in the early years.
The way you continue to grow is off of a foundation, is off of a really, really strong foundation. And NASHP has that kind of reputation. It's built it up over the last 25 years. It will continue to do so.
Because of NASHP, states, the federal government, associations like mine are making better decisions today. We're doing things that are based on evidence. we're doing things that we know work. And without NASHP, that just wouldn't be the case.
At age 25, NASHP has said to the country, if you want to improve health care and if you want to improve health outcomes for the population, you need to pay attention not just to national policy and not even just to state policy, but to how states go about the business of implementing the many programs this country has that are intended to improve health care and health outcomes. That's what we do, that's what we will always do.